Um, I think it's about afternoon there where you guys are. It's quite late here in India. Based out of Dharamshala, and I'm currently working in WHO. I support the tuberculosis program in the state of Himachal Pradesh, which is at the heart of the Western Himalayas in India. So it's pretty cold out here. So I've kind of planned a session. So my PPT doesn't have exactly a lot of information, but I am kind of hoping that we kind of have a discussion, and it's more like an adult learning. So I can see quite a lot of participants, and I'm very happy that, there's like, I think that's going to allow us to have a really good discussion on this topic. I'd like to share also some of the basics of human health and climate change and how they're related. And I would more focus on what kind of work Asar is doing at this point for environmental health. Again, do feel free to stop me anywhere, anytime. If you guys have any doubt or any query that you want to ask, feel free to unmute yourself and interrupt me. It's not a problem. So some assumptions that I would like to make here is that the participants know and are aware of about climate change. The participants are aware of some of the climate change impacts that we are seeing, and the participants have skills to synthesize knowledge and information, translate that into action. These are some of the assumptions that I have made and going ahead. But quickly, if anybody can just unmute themselves and just tell me what they think or what they know about climate change, just as a discussion, like a starting point. If anybody can unmute themselves. And there are no I'm just trying to kind of ask if there's any awareness here, if there are any ideas about climate change that anybody has, and how it is different from, say, a weather alteration or a weather event. How is climate change different from that? If anybody can just unmute themselves and go ahead and answer that.
Zadey, 2023 was considered the warmest year in the history.
Right. So would you call that a weather event or a climate change event?
A weather event related to, or maybe caused by, contributed to by.
By climate change. Yeah, absolutely right. Yep. So climate change is more of it's a long-term impact that we see. So weather is when we talk about weather and climate change, so climate change looks at a larger and a more long-term impact. And so keeping that in mind, I would like to go ahead and ask whether does climate change impact the world equally? I've posed this question to the audience here, to the participants here, and I just want like a yes or a no, and if yes, why? If no, why? If anybody would like to. Yes, hi.
Yeah, so I'm Grishma. So I think climate change is affecting people disproportionately. Like there are like vulnerable community which is being affected by climate change more than the other population.
Wonderful, absolutely. Does anybody think that it affects everybody equally? Does anybody here think that it affects everybody equally, or? Okay, so everybody agrees. Oh, that's great. So everybody agrees. So that is absolutely right, that climate change does impact the world unequally and quite disproportionately, to be precise, because the impact of climate change depends on multiple factors. So I just wanted to go through some of the very pertinent discussion points, that definitions that are very important in understanding climate change. One of which is vulnerability. We keep talking about vulnerable. This country is more vulnerable than the other country. This state is more vulnerable than this state, this other state. These rivers are more vulnerable than other rivers. So we keep kind of taking this word like time and again when we talk about climate change impact. So what does vulnerability exactly stand for? So the Intergovernmental Panel for Climate Change has clearly defined vulnerability as the degree to which a system is susceptible to or unable to cope with adverse effects of climate change, including climate variability and extremes. So it talks about a system that might be more susceptible or less susceptible to an adverse effect of climate change. Then we keep talking about hazard and risk. So when we talk about risk, what IPCC says is that it is the potential for adverse consequences for human or ecological systems, recognizing the diversity of values and objectives associated with such systems. In the context of climate change, risk can arise from potential impacts of climate change as well as human responses to climate change. And an adapt we also I also wanted to introduce the term an adaptive capacity. So a adaptive capacity is defined as the ability of a system to evolve in order to accommodate these climate changes that are happening or to expand the range of variability with which it can cope. So these three terms are really important is because when we want to create a public health action plan or an adaptation plan, we need to look at all these three factors while devising one. So I wanted to introduce these definitions beforehand. So WHO came up with this beautiful infograph where it kind of summarized climate change and health in a really seamless and an elegant manner. So where first they spoke about vulnerability factors that can impact, that can have an impact on the health outcome, on how people in general will experience health outcomes related to climate change. So a certain demographic, it has a, you guys, you can see the list is demographic factors, there's geographical factors, there's biological factors, socio-political, socio-economic, health system capacity, and gender and equity. So when we talk about like a demographic factor, say suppose age, let's talk about age of a person. Do you think so a climate change phenomenon, like we spoke about temperature, somebody said that one of the participants said that last year was one of recorded the highest temperature. So do you think that because there was high temperature that affected a certain kind of age group more than it did some other age group? Do you agree with that? Do you think that's possible?
Yeah.
Like, for example,
older adults would be impacted, and then they would be at higher risk.
exactly. Thank you. Thank you so much. That's exactly, that's right. So older people, or for that matter, infants or younger people. So you have these extremes in the demographic, in the age group that will be more affected. This is so when we talk about susceptibility, that's what we mean by vulnerability over here. Then coming to geographical. So when we talk about geographical vulnerability, we talk about sea level rise. And the moment you talk about sea level rise, the first thing that comes to your mind is the small island countries that will be affected much more than a larger country that is not surrounded by sea at all. So again, there is a disproportionality over there. Biological factors and health status for somebody who is already comorbid, who already has a range of diseases within them, climate change would impact them they would be much more susceptible to a climate change impact. Again, a health system capacity. So if a health system in general is not equipped or not resilient enough to cope with certain climate related hazards, then that will make them more vulnerable to such hazards. So moving on to climate related hazards. So exactly in health, there is enough evidence right now at this point which says that extreme weather events, heat, sea level rise, air pollution, vector distribution, and water scarcity and reduced food production have direct health impacts. And the exposures are usually to peoples and communities, health workforce, infrastructure, energy system, water system, food system, and the health system. Some of the health outcomes that are established through literature right now are injury and mortality from extreme weather events. So if there is a cyclone or there is a flood event, so you usually see injury and mortality that arises from there. Then if there's a temperature rise, you see heat related illnesses that come up. Then you have respiratory illnesses attributed to exposure to high level of air pollution, waterborne diseases and other water-related health impacts when the climate-related hazard impacts our water system. You kind of see a rise in hepatitis A, hepatitis E. And then there's zoonosis, there's change in the vector-borne diseases. We also see difference in the spatial distribution of vector-borne diseases, malnutrition and foodborne diseases. So we spoke about reduced food production as one of the climate-related hazard, and that eventually has an impact on food security, which then again will have an impact on malnutrition and undernutrition at that place, followed by non-communicable diseases and mental and psychosocial health. In addition to this, there's also a separate impact on the healthcare facilities and effects on the health system as well. So WHO came up with this infographic with enough and more evidence out there, but still not enough yet, I would say, where they've kind of linked all of these hazards to definitive health outcomes. So this is again just a summary that I created out of the right now the kind of health impacts that we are seeing attributed to climate change, which includes just a second, I can't see my slide. Yeah. Heat effects, vector-borne diseases, waterborne diseases, extreme events, climate refugees, impact on agriculture and nutrition security, increased risk of chronic disease, exacerbated air pollution. So when we talk about, just a second, slide is on the way. Okay. So when we talk about heat effects on health, we talk about heat exhaustion, there's heat stroke, there is cerebrovascular events that happen, there's circulatory failure, there's renal failure, exacerbation of pulmonary disease. So heat in general does not just have a direct impact in terms of heat exhaustion or heat stroke, but it also exacerbates the diseases in already morbid individuals. In vector-borne diseases, we are observing that over the course of the last few years, there is a spread of vector-borne diseases to new areas that have never seen such type of vector diseases, changing in the spatial patterns, longer transmission windows, and shorter extrinsic incubation period. So this is what is being observed according to the recent literature. It is change in vector-borne disease patterns. So specifically to India, at ASER, we specifically looked at the spatial pattern, and the states that never had dengue diseases have started seeing dengue diseases. Areas that have had higher altitudes and colder temperatures have now started seeing vector-borne diseases. So this is evidently it has been attributed to climate change. Climate change to nutrition, about by 2100, 40% of the world's land surface is likely to be experience altered climate. And by 2050, about agricultural input is projected to fall by 2%. And the food demand is projected to rise by 14% per decade. So this is going to lead to an extreme food insecurity. So as you all are aware that, so there is a phrase in climate change when they talk about the El Nino and the La Nina effect, where they say that the wet places will get wetter and the dry places will get drier. So we will in future look at more flood events and more drought events, so which could lead to extreme food insecurity. So direct and indirect of nutritional health is the reduced crop production that can affect. So when the staples are affected, rapid crop maturation that can lead to decreased nutritional content, which could have an effect in the growth and development among children, adolescents, and pregnant women. Transition to processed and fueling overweight. So there is going to be, it is estimated that from there's a paper by Swinburne et al., where it said that there would be a global syndemic of obesity, undernutrition, and climate change all together, all at the same time, because of climate change. Waterborne diseases, an increase in incidence of waterborne disease due to flooding and pathogen spread through water systems, air pollution, because of rapid urbanization, we're seeing a lot of air pollution and respiratory morbidity and mortality. So Delhi is one of the cities that has the highest and the worst air quality index. So we are there is enough and more data that says that the hospital admissions with like children getting admitted to hospitals having respiratory diseases spikes up during the winters because the smog is settled and the respiratory morbidity conditions are increased during the winters in the city of Delhi attributed to air pollution. Mental health is also affected due to post-traumatic stress disorders as a result of an extreme weather event. We often see a lot of psychological and mental health disorders among those who have suffered the weather event. So this was, I know it's a very grim picture and it does leave us with certain kind of anxiety, but all hope is not lost. We're still at a point where we can rectify our mistakes in the past, take good actions in the future. But at present, for that, coming up with a good adaptation plan is very, very important. So public health response to climate change and health. So response to climate change uh, given by the United Nations for Climate Change and Health suggests a national adaptation plan. So a process was established under the Cancun Adaptation Framework. It enables the parties to formulate and implement national adaptation plans as a means for identifying medium and long-term adaptation needs and developing and implementing strategies and programs to address those. So these had two objectives. One was to reduce the vulnerability of the impacts of climate change by building the capacity and the resilience of that place. Second, to facilitate integration of climate change adaptation in a more coherent manner into relevant and new existing policies and programs, and particularly when there's a development plan happening, to include and do it in a much more sustainable fashion. But what role does health play into these national adaptation plans? So what I would like the participants today to do is that all of these plans are readily available on in the internet. You can look at your national adaptation plan and take a look if they've mentioned health in it, or whether your country or wherever you guys are from right now, you can see if there is a separate health related national adaptation plan or not to cope with climate change and its impact on health. So a health national adaptation plan has been devised. So WHO has come up with a guidance document to ensure that the process is of managing health risks of climate change is integrated to the overall national adaptation plan, including assessing risk, identifying and prioritizing and implementing adaptation options, and monitoring evaluation of these adaptation process. So in 2010, WHO assessed the inclusion of health in national adaptation program of actions conducted by least developed countries and small island states. But this was not enough discourse to include health in the national adaptation plan. So there are still several countries, as you will see, which have still not included health in the discourse of national adaptation plan. And it is funny because climate change directly affects not only the environment itself, but directly affects human beings. And the immediate impact that you see is on their health. So a repeat survey in 2017-2018 was conducted of about 100 countries, but only 50% of them had some sort of a national strategy for climate and health. So the WHO toolkit kind of includes when they said that you need to make a health related national adaptation plan, they said you should include health impacts of climate change, vulnerability and adaptation assessments, early warning systems, building resilience of health systems, national adaptation strategies and plans, monitoring and evaluation of health adaptation, engagement with other sectors, health co-benefits of climate action, and training and capacity building. So these were some of the pointers that WHO toolkit gave to the countries who are devising health national adaptation plans. So a vulnerability and an adaptation assessment is extremely important and extremely critical So WHO says that this is the first step in recognizing what kind of climate change impacts you have in that region. So whenever you come up with an adaptation plan, it is tailored to the kind of risk and vulnerability of that geography and the population. So VNA assessment does not only improve the understanding of linkages between climate change and health, but they can also serve as a baseline analysis against which changes in disease risk and protective measures can be monitored. They can also provide opportunity for building capacity and can strengthen the case for investment in health protection. So some other components that the Health National Action Plan will include is early warning systems, such as strengthening disease surveillance and early warning systems for climate sensitive hazard like infectious disease. So if there is a climate hazard that is going to affect, say, a water system, so having and strengthening and having a robust disease surveillance for, say, at that time, all the waterborne diseases would come in handy. Based on the VNA assessment, develop a comprehensive health adaptation strategy and programs and policies, strengthen institutional and organizational capacity to influence own and other health determining sectors, build a strong MNE or monitoring evaluation plan, and build a strong case for climate finance and inclusion of health in every region's nationally determined contributions. So whenever there are these COP meetings that are happening, so right now the latest was a COP26, countries kind of submit a nationally determined contributions where they say that they give themselves targets that they would reduce, say, the greenhouse gas emissions by a certain percentage. So having a health national adaptation plan also says inclusion of health in these NDCs. So what are we doing exactly at ASER? I would just like to give you like a brief overview of what we have studied so far and what we are currently studying. So we came up with an op-ed article in the Think Global Health where we looked at heat, dust, and fever. So we looked at the India's climate adaptation plan for health and how that should reflect the regionals and nationals need. So we kind of, this was an advocacy piece to come up with a need-based adaptation plan for climate change. So WHO has given these recommendations. They have told the countries that you need to include this, you need to include this, you need to include. So it's given like they've given a toolkit, but tailoring it to the country's needs is something that absolutely needs to happen. And somewhere when we were looking at the literature, when we were looking at the action plans, they were found to be lacking. So right now what we're doing is that WHO came up with a quality criteria for the health national adaptation plans. So at the moment, ASER is looking at the national adaptation plan for climate change and health of the country. We've come up with a draft in 2018. We've come up with a plan, and subsequently, so have the states in the country come up with their own state action plan for climate change and health. So these adaptation plans are definitely based on the WHO's toolkit, but somewhere it lacks the quality that is needed. So we are running these these adaptation plans against this quality criteria, and we've kind of marked which criteria is missing or which quality criteria is missing and which policy could be improved in the national adaptation plan. So right now in India, what is happening is that based on these national adaptation plans and the state adaptation plans, the states have already asked for funds from the center or from other sources or donors in order to incorporate and implement these plans. But it's crucial that so right now we are at a little bit, I mean, a little strapped for time because there are states who have already started implementing, but they've not had a very robust vulnerability and adaptation assessment done. So there is a very generalized norm that's going on, but that is why it's crucial that when these adaptation plans are made, it is made at a very, very granular level, keeping in mind the local context, the local demography, the local cultural traditional practices. So that is what we are right now studying at ASER. So, through today's talk, what I did want to kind of insight in the participants who've attended today is that I wanted you to start thinking about health in context of climate change. So, when you talk about climate change, you need to start thinking about that, as one of the participants said, that what the disproportionality in the impact of climate change, about how unfair it is. So, and it's crucial that whenever an event or a climate change hazard is happening, we are prepared to cope with it. So, even though we have enough evidence out there, there is still not enough yet. We still have a long way to go. So, generation of evidence and using that evidence for advocacy with higher parties, with people of influence, is what I want today's participants to take away. So there are a lot of resources which I am happy to share with the group that y'all can start looking at. But yeah, this is all I wanted to share in today's webinar. And if there are any queries, and the floor is open for a very healthy discussion on the topic. So at ASR, we don't really consider ourselves as experts because we're kind of learning these topics as we are researching them. So I would say that there is still a lot of knowledge gap even when we are researching these topics, because 3 years ago, even I hadn't heard of these terms. But then when we started working on these projects, we got to know that there is a lot of work that is being done. So if anybody else has come across something new in this regard, I would love for them to share it in this forum.
Hi, my name is Mateo. I'm outside, so I'm sorry if there's a lot of noise. But thank you so much for your wonderful presentation. I really learned a lot. And yeah, I love the emphasis on the disproportional impact, but also disproportional in terms of who produces a lot of the emissions historically, right? And I just read this really amazing book that I'm telling everybody to read. It's called Inflamed, a Deep Medicine and the Anatomy of Injustice, by Raj Patel and Deepa Mira. I mean, it's really, really, really good, right? It talks about the ongoing legacies of colonialism. It talks about climate change. It talks about capitalism, and how all of these forces kind of work together to further impact public health. And I work in the U.S., and I think especially here in the United States, we don't ever really talk about climate change with centering health and people's health. So yeah, just thank you so much for that framework. I'm really eager to hear what others think.
So
yeah,
in
I'm
US,
curious
I
what your-
remember that
yeah.
I think there was this discussion of health in climate change. I'll tell you afterward. So you remember in Texas when there was the whole snowstorm that had happened? So where people, I mean, like so many people died, and like the pipes were frozen, there was no food for days. So that's when I remember health coming into the discourse of climate change in the United States at that time. So it takes an extreme weather event to happen, and a lot of impact to happen when like in order for a serious discussion to take place. So I really think that shouldn't be the way, because there is enough and more evidence out there that does say that climate change impacts human health significantly, and the only way to solve this is also to convince people who make policies that it's going to affect you, it's coming for you. So there's no escaping it. It's coming for everybody. So we better buck.
No, Aatmika, that was great. I feel like even I learned a little bit something new. I always feel that way whenever I listen to you. So I would I just kind of, yeah, since Matteo talked about US as an example, and I think in the US, it talking about climate change in an impactful way and bringing health into that is is more challenging, because there is a whole, I believe, like a political divide on the existence of climate change, right? And whether it's human-driven climate change or not. So, but I'll still give like two really concrete examples, which are not extreme weather events, right? But the US felt that climate change is driving health problems. So one, and both of them kind of like happened around the same period. So last year was also one of the warmest summers for at least some part of the US, especially in the southern states. Uh, I so last year I was living for a while in North Carolina, in Durham, and so during summer, two problems that we saw come up a lot at Duke. One was that people were coming in, especially those with heart disease and those with hypertension, because they had to change their prescriptions with warmer climate. So that's something that's going to happen more and more clinically. Climate change, warmer temperatures have physiological impact, which is especially difficult for people who are hypertensive, people who have disease for cardiovascular, people who have like generally higher cardiovascular risk. And so that's probably, at least like in my reading, one of the first times where that became a public health problem, because in outpatients, you are seeing more people talking directly about their health in the context of something that happened in the broader climate, right? So there is that. And then the second example, and the kind of like chain of events here is more like long to imagine. But the second example is that of snake bites. So we saw a lot more snake bite patients at Duke ED. And that's because warmer climate, animals coming out of their habitat, snakes coming out. North Carolina in general has more snakes than other places. And so now you have snake bites and poisoning. So yeah, again, I mean, so I think saying that there might be impact of climate change on health in future, or saying that it's difficult to imagine, is not probably going to like last for long. I think it's already here. We are starting to see it. It's just that it's going to maybe take more initiative to acknowledge that it's actually these high systems level like things that are causing changes that you now feel at individual level. So yeah, just wanted to like add that.
Thanks, Adesh. That's like quite very well put. So in addition to what we were discussing, I would also want to, I think I kind of missed it in my presentation as well. So when we talk about climate change and health, there is a certain responsibility of health system here. So when we talk about health system in general also, so there is a consortium that has been built right now in the world where the health systems have kind of pledged to reduce their own greenhouse gas emissions, reduce their own usage of water, come up with more sustainable techniques and methods to keep the health system going. So their agenda or their pledge was that if we need to tell people that okay, like stop using fossil fuels, we need to set the example. So building resilience and building the greenness of a health system is also something that is up and coming as a result of these adaptation plans as well. So especially in India, in the state, there's a state called Chhattisgarh. So in one of the villages, there are about 3 health centers who put up funds, who asked for funds from the center to make their entire health facility based on solar. and they came through, and there are about 5 health facilities in that particular state, in that particular area, that solely runs on solar powered energy. So there are slowly but surely there are changes coming up, but it is not in the magnitude that we would want, because the problems are a lot more than the solutions right now. And webinars like these, talks like these do encourage people to start thinking in that manner. So I see somebody who shared something on the chat. I'll just read it out for everybody. Priya says that the Royal College of, oh wait, I lost it. And Physicians and Surgeons of Canada has made planetary health a core value and is incorporating it into all undergrad medical curriculum. And this is a new formal change coming up from the top. Oh, that's lovely to hear. Oh, we have like a bunch of resources shared as well in the chat box if anybody wants to look at it. Adna is saying, thank you so much for the plethora of informative and motivational resources you've shared, for all the good work you do. I agree, systemic solutions are needed at all levels. My personal experience as a medical student have been witnessing an increasing number of cases in heat stroke, absolutely, and other heat-induced conditions. At summer, working at a clinic for cardiovascular illnesses, absolutely right. There is a beautiful study that was done in Ahmedabad, which looked at increase in all-cause mortality in the state of Gujarat in the span of about 2 years when they had the heat wave going, and the evidence was statistically significant. It showed that during the months of the heat waves, there was a significant rise in the all-cause mortality that was observed in the hospitals in Ahmedabad. So you're absolutely right, Adna. There is good evidence that, so I can share that paper as well in the group.
Yeah. Hi, everybody. First, can you hear me well?
Yes.
Thank you so much, Anakrati, for hosting this, for organizing it. And big thanks to Aatmika as well. I've learned many new terms in this presentation, and it's certainly always invigorating to hear colleagues who are doing this kind of work, not only interdisciplinary, but tackling such, at one point, Aatmika said grim, use the word grim, which I agree is inherent when we begin to observe the research, increasing body of research coming out on the topic of the intersection between climate change and human health. So it can be grim, but I agree, shared action is necessary. So I come from Bosnia and Herzegovina. Actually, I would like to share about an international coalition for climate action and prevention science. I had meant to share those resources during the lecture, but I wasn't sure when the right moment is, but maybe now is a good chance to introduce. There's a coalition that is being gathered of a group of researchers, most primarily from Europe, but also Northern America, Canada, as well as the United States. So I'm not sure if colleagues, Aatmika and colleagues, would like to be part of that. If so, I can share. There's a website that is being, that has already been, the website is up, but it has not yet been populated. And so colleagues from the Pacific Research Institute are looking for contributors. And I think certainly it would be an honor and privilege to have Aatmika and colleagues be part of that working group as well, a coalition. So I will share the link to the website for International Coalition for Climate Action and Prevention Science, as well as a contact of a colleague who is heading that.
Please do, Adna. That would be lovely.
Of course. Thank you.
That would be great. Thanks.
Thank you very much. This has been fascinating, and I'm reminded of getting my master's degree in community medicine from Liverpool a few years ago. And part of our research was done in India. And so I went to Uttar Pradesh, and I was impressed at how the local strategies for many things were quite different than national strategies. And the postgrad students I was working with were very interested to try and collect evidence about it. So I'm curious, Dr. Nair, to what extent would Uttar Pradesh have to come up, or have they already come up with an example of how they would strategize? Because different parts of India are very different in terms of climate impact. Thank you.
Thanks for the question, Donald. So in 2019, there was this really good document. I'll share it in the chat as well, that came out from the Council of Energy, Environment and Water. They came up with a district vulnerability assessment for the entire country, where they ranked the vulnerability for every state and for every district. So we're about 767 districts in the entire country. So the vulnerability index was mainly based on sensitivity, the climate change hazards, and the adaptive capacity of that state and of that district to cope with those hazards. And they ranked these states according to their vulnerability. So they came up with these indices, So I can just kind of share a quick, so we kind of did it for our paper as well. We kind of accumulated that data. Let me just pull that up for you. All right, okay, wait. Okay, here we go. I hope my screen is visible. Is my screen visible?
Yes, we can see it. Thank you.
Oh,
Yeah.
all right. Yeah. So in this paper that we kind of put through, we kind of came up with this visualization. Let me just. So here what we did was we came up with the 20 Indian states that were most vulnerable to climate change from this data source that I just mentioned. So here, as you can see, that Assam is #1 on vulnerability. So, Donald, I mean, I'm sure you must have heard that Assam is it floods and there is rain throughout the year. Plus, in addition to that, their adaptive systems also in place. They've been ranked #1 in terms of their vulnerability. Followed by, we have rank 2, who's Andhra Pradesh. And then we have about, I think then comes, if I'm not mistaken, it's a smaller place, I think. Okay, yeah, then we have Karnataka at rank 4. We have Maharashtra at rank 3. And then we have Rajasthan at rank 7. So these are some of the places where data was available, and we came up with the 20 most Indian states. So, it's really important that when I said that the vulnerability and adaptation assessments, when they're being done at the most granular level, because one area will differ from the other area. And India, specifically India being such a vast country, such a diverse country, climatically and geographically and culturally, so it matters a lot more in a country like ours. So I hope that answers your question about why we do need a very granular vulnerability and adaptation assessment being done to come up with better and more relevant contextual adaptation plans.
Yeah, thank you very much. That's the exact example I was hoping you would put up. Thank you.
Thanks.
Aatmika, can I also quickly add to that? So
Sure, please.
India, yeah. So at least in India, the idea of like having a national climate change and health adaptation plan is to just provide a broad framework. And so the national document specifies that it's up to states to have their own plans based on the framework. And then even beyond states, they ideally want to have district level committees to do more like grassroots work based on the state plan. So in theory, there is a structure for having a decentralized effort with the central government being more of a, I guess, overseeing body for all of this than like initiating it.
Especially if you do, guys, if some of you do have some time, do go through the Lancet countdown. It's one of the most well made, and they cover a lot of indicators related to climate change and health in a very, very unique manner. So if anybody had, so I'll put a bunch of resources and interesting websites that the participants can look at, and I'll share it with you. I just wanted to thank everybody, and I just wanted to thank Anukriti for this opportunity, because I think we don't get to do this very often. So Asar is, I mean, we are at this moment where there is a lot of work to be done, and especially in this project, especially related to climate change and health, and we're against a huge, huge mountain, but we have a very dedicated team that's working. And thanks, Adna, for the site of the coalition. We'll definitely look into it. And this was lovely talking to everybody. And yeah.
Say anything, except I really appreciate the international perspective here. And people are working in different countries, Eastern Europe and other places. So it's for me, it's very informing, and I look forward to more emerging leaders amongst this group as we head into what's going to be incredibly challenging. And I also, even when I'm speaking with my children, some of whom are in their 20s and some of whom are in their 50s, hey, you should pay attention to this, and I send them materials. So I'm really glad that the education is coming from all over the place. Thank you very much for all that.